Welcome, it's Eitan Shalom, and today I'm with my patient. I'll call her Sally, and she's a ballet dancer, and so she's far exceeding the normal demands that our bodies were designed for, both because of her schedule as a dancer and as a teacher, and the fact that it's ballet, so she does toe as well. And so she's having chronic myofascial pain, what we can also call trigger point pain, in her hip. This is her left hip. It's the lateral rotators and stabilizers of the left hip. And in the next video, we'll be doing the hip flexors on her right hip. But her case is pretty simple. I've treated her many times before, and her case involves inflammation or active trigger point activity. She's got an active trigger points. These same trigger points are latent in every human being, and they're not bothering her on the right side. Those are the latent ones. These are the active ones. And in they're really actually the motor points of the muscles. So motor points are in layman's terms, the brain cell of the muscle. The motor point is where it's called the myoneural unit. It's where the nerve kind of grows into the muscle, and it's a specialized tissue bundles that relay bioelectric signals from the brain via this motor nervous system to the muscles. So, and they can get inflamed in the same way that trigger points get inflamed, but they have a slightly different function in that when you needle the motor point, the great thing about it is it causes the whole muscle to release. It causes the muscle to lengthen. And so I'm gonna be needling. I've already located where her pain was, and it just happens that where her pain is on the motor point of the gluteus minimus, motor point of the gluteus medius, and also the fascial attachment. So this is not a motor point. This is inflammation in the fascia. You can call it a trigger point because you do get trigger points in fascia as well as muscle. And I'll show you like a little picture here from a motor point book that I sometimes use as a reference. This is the greater trochanter, the bone on the outside of your hip. And this white part is the fascia. So it's where the muscle or tendon, muscle's attached to bone with tendons, but there's a layer of fascia over that. And so I'm going to get my needles now, which I forgot to get before I started. And so I normally use two hands to put in the needles. These are easy enough points that I can do with one hand. Otherwise, I wouldn't be able to do this part of the video. So the method is I'm going to tap. So normally I would be holding that shaft. The dry needles and acupuncture needles, unless it's a medical doctor doing needling with a hypodermic, without any solution, which would be a dry needle. And dry needles and acupuncture needles are the exact same needles. So when a physical therapist or chiropractor does dry needling, they're using acupuncture needles. One could argue that dry needling is a specialized form of acupuncture in which that's not based, rather than being based on the channel theory of classical Chinese medicine, it's based on an anatomical knowledge of the anatomy and location of trigger points. So this one, I'm going to tap. There's the needle. It's in a tube. I'm going to tap it in, take a nice breath. And as she exhales, it's less painful if you put the needle in while the person exhales. So I'm going to get all three in first, just because I'm only using one hand, and that way it won't bother her. And here comes the next one. So take a nice breath. I'm just at this point getting them underneath the skin so that I can then insert it better. And here's in fact, what I'm going to do now is put the camera down over here, and that should still keep me in the picture. Yes, it does. And now I can use both hands the right way. And now I'm going to get the one in the fascia. All right, so now I'm going to stimulate. Let me use I would use my left hand normally on this side, so, but I don't want to block. So I'll move my body. So, and tell me to stop if it's too much. So I'm lifting and thrusting to see. There we go. Did you feel that?
Oh yeah.
Is it good?
Mm-hmm.
Okay. So she's used to this, so she knows what to expect. I'm lifting and thrusting the needle until I feel movement in the needle, like a twitch. It's called the twitch response, or fasciculation is the Latin word used in medicine. A fasciculation and a twitch response are the same thing. I feel like this one is slightly off because I was only using one hand. So I'm taking the first one out and redoing it. There we go. Okay. So this one's probably going to be stronger. You okay?
Mm-hmm.
So stop me if it gets to be too much. There we go. I wish you could have seen that closely, that you could just see it jump. Like one of my patients years ago would come in and I would needle his wife and he would laugh and he would say she looked like when you run electricity through a frog in biology class. And it's exactly right, because our muscles operate because of electricity. It's bioelectricity. It's the positive and negative charges being exchanged between sodium and potassium. It's called the sodium-potassium pump, if I remember my college physiology. You okay there?
Mm-hmm.
So you felt it jump again, right?
Oh yeah.
Yeah. So I stimulate it multiple times, once or twice as I'm going in. You right there?
Mm-hmm.
Okay. And then I'm going to let her relax a little bit. You okay?
Yeah.
A lot of physical therapists just stimulate it, get the response, and then they're done. My preference, because I like to be very thorough, is I stimulate, and that method can work with very simple cases. This is a more chronic case, and so there's a huge difference between somebody that never had trigger point pain before in a spot, and then they played baseball or they lifted weights, and they don't normally do that, and they suddenly have an acute case. That case, stimulate it, boom, 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 and you're done. But in a chronic case like this, because muscles have layers of tissue, I get the needle in, and I lift and thrust, and now I get a fasciculation, and now the muscle lengthens. But now the patient's also very relaxed because she now has endorphins rushing through her brain, which are like opiates. So I leave her alone, she's going to relax, and when I come back, because she's relaxed, the muscles have now lengthened. Now if I stimulate it again and then take them out, I've got more bang for the buck. I now have muscles that have lengthened even more. I now have trigger points that have been even more deactivated. And then, of course, because I like treating the whole person, if, for example, if she had this and she was really frustrated and stressed out with her job or her social situation at home, which she's not more than normally, just kidding, which she's not, then I might do points that are even further to promote relaxation of the mind. Because when your mind's relaxed, you're way less likely to get trigger points activated. Because trigger points, like take the case of tension headache and migraine, people can get tension headache and migraine who are not ballet dancers. It's not because of some physical activity that they did, it's because of mental tension. So every single human being benefits from the relaxation response. She doesn't need that today, and I don't normally do that on her actually as a particular person, but there are many people that I would. I could also add, let's just say she had this problem and really bad menstrual cramps, and she was premenstrual and she had really bad back tightness. This would now be the difference between doing dry needling alone and doing Chinese medicine. I would want to treat, if she was interested, the whole person, and then I could easily combine this with points on the mid and low back for menstrual cramps and premenstrual tension. Okay. So I'm going to leave her alone for a few minutes. We're calling you Sally, so thank you, Sally. And I'm going to just give you one last close-up view. You can see those are, oh, sorry, it went out of focus. Those are two, what size needles? These are 50 millimeter needles, which are something like, yeah, they're 2-inch needles. And as you can see, there's plenty of muscle there, and also being the butt, we all have fat on our buttocks. So I'm going to come around this way. I think you can see better. No, this way. So you can see that the needles are in, if those are 2-inch needles, the needles are in about 1.5 inches. And that's just what we want to do, because that's where the muscle fibers are. Okay, I'll be back when we do the dry needling on her hip flexors on the opposite leg. I won't come back and show you the cupping because it's just not that interesting, and I've done cupping videos before. Okay, thank you very much, and thank you, Sally.